Okay, let's just state the obvious. You can't escape Ozempic, right? It's not just some medication anymore. It has exploded into this full-blown cultural phenomenon. I mean, it's everywhere, in our memes, all over celebrity gossip, and, at the center of some of the most intense debates we're having about health and weight loss.
And this quote? Wow, it pretty much says it all. Think about it for a second. That simple question, are you on it, has literally replaced how are you in so many conversations. That's not a small thing. It signals this huge, massive shift in how we're all thinking about our bodies, and frankly, the lengths we're willing to go to change them.
So, what's the real story here? I mean, is this thing a straight-up medical miracle? Maybe the biggest breakthrough we've ever seen for metabolism? Or is it some kind of metabolic trap with a whole bunch of consequences we haven't even begun to understand? Well, that's what we're here to figure out. Let's dig into both sides of the coin.
All right, before we jump into all the controversy, and believe me, there's a lot of it, we've got to understand the science behind it. And honestly, from a biological standpoint, it is kind of a masterpiece. So how does this so-called cheat code for the human body actually work? Let's break it down.
Okay, it all boils down to this one little hormone called GLP-1. The easiest way to think about it is like your body's built-in, totally natural appetite suppressant. Right after you eat, your gut releases it, and that little guy sends a message straight up to your brain that basically says, hey, we're full down here. You can stop eating now.
Now here's where it gets wild. Look at this comparison. Your body's own natural I'm full signal, it lasts for like 2 minutes. That's it. But semaglutide, the active drug in Ozempic, it sticks around for a whole week. That's not just a little boost. It's like taking that tiny signal, hooking it up to a giant concert speaker, and just leaving it on 24/7. And for the people taking it, the effect is, well, it's profound. They call it the death of food noise. You know that constant nagging chatter in the back of your head about what you're going to eat next or cravings you're fighting? Imagine it just stops. For a lot of these folks, it's the first time in their entire lives they've had that kind of silence in their own minds. And this right here, this is the absolute core of the whole cheating debate. I mean, think about it. If someone's body has a biological problem, a signaling issue, is treating it with medicine a moral failing, or is it just medicine? This whole analogy with glasses really makes you think, doesn't it? If you need glasses to see, are you cheating at vision? Okay, but every masterpiece has its dark side, right? And this one is no different. The incredibly fast weight loss that makes it so effective, well, it comes with some really serious and often hidden physical costs. So let's talk about the price you might pay. So, I'm sure you've heard the term Ozempic Face thrown around. Well, let's clear something up. Medically, there's no such thing. It's a myth. What people are actually seeing is rapid fat loss face. When you lose a ton of weight really, really fast, the little fat pads in your face, the ones that kind of hold everything up, they just disappear. And that's what leads to that hollowed out, sometimes older look. But look, Ozempic Face is really just a cosmetic thing. What's truly alarming to doctors is what's happening under the skin. It's something called sarcopenia, which is a fancy term for severe muscle wasting. This is the side effect nobody's really talking about, but it's the one with the most serious long-term consequences, for sure. And just look at this chart. It really shows you how dramatic this is. If you lose weight with a healthy diet and exercise, maybe about 20% of that loss is muscle. That's kind of normal. But with these GLP-1 drugs, studies are showing it can be as high as 40%. That is a massive amount of metabolically critical tissue you're losing. It's not just the fat that's melting away.
And welcome to what people are calling the Ozempic trap. Here's how it works. You lose a ton of that important muscle, so your metabolism slows way down. Then, the second you stop taking the drug, that food noise we talked about, it comes roaring back with a vengeance. That 1-2 punch makes it incredibly difficult, almost impossible for some, to keep the weight off. And that creates this cycle of lifelong dependency. So this physical trap we just described, it leads us right into a huge ethical mess. Because this drug has just exploded in popularity, it's kicked off this really fierce debate. Who should actually be getting these drugs, and for what reasons? And we're not just talking about fairness here. The stakes became literally life and death. The demand from people using it for cosmetic reasons got so huge that it caused global shortages of the drug. Just think about that. It meant that patients with type 2 diabetes, the people this medication was invented and approved for, couldn't get their hands on their life-saving medicine.
And this really lays out the central conflict, doesn't it? On one hand, you've got this new field of cosmetic endocrinology, people using this incredibly powerful drug to look snatched for a vacation or lose those last 10 stubborn pounds. And on the other hand, you have the reason it exists, as a critical medical intervention to prevent kidney failure, to avoid limb amputations, to treat a chronic, debilitating disease. The difference couldn't be more stark. But it's not that simple. To counter that argument, many doctors will tell you that for patients who have what's called obesity biology, where their own hormones are basically at war with them, fighting weight loss at every turn, this drug isn't a cheat code. It's a prosthetic. It's a necessary tool that helps fix a fundamental biological problem. So, we've talked about the physical and the ethical, but there's another layer here, a really deep psychological price that we're only just beginning to wrap our heads around. Think about what's happening. We've taken one of the most fundamental human acts, eating, and we've medicalized it. We've turned it into a procedure. And the fallout from that, it's huge. And it's led to this phenomenon that doctors are now calling pharmacological anhedonia. That sounds complicated, but it's simple. It's a drug-induced inability to feel pleasure. We're not just talking about not being hungry. We're talking about the removal of joy. You know, the pleasure you get from sharing a meal with friends, the taste of your favorite food, the happiness of a birthday cake. All of that can just disappear. I mean, just listen to this quote from a patient. I have to remind myself to eat a cracker because the thought of food is repulsive. Can you even imagine that? Food, something that's supposed to be about pleasure and connection, becomes a repulsive chore you have to schedule on your calendar, completely disconnected from any kind of joy. So what does this mean long term? I mean, psychologically, we're risking creating an entire generation of maintenance. A generation whose health and body image aren't tied to their own actions or choices, but to a weekly injection, forever tethered to a pharmaceutical company for a feeling of normalcy.
All right, so we've seen the miracle and we've definitely seen the mess. So where do we land on all this? What's the final verdict? Let's try to bring it all together.
Okay, first things first. The word cheating, it has absolutely no place in a medical conversation, period. For someone who's genuinely on the brink of serious health issues like heart disease or diabetes, this drug can be a literal miracle. It is a powerful, legitimate, and life-saving tool for preventing disease.
So really, the smartest way to think about this drug isn't as the final destination. It's a bridge. It's a temporary tool that helps you get across to the other side. You use it to get to a healthier weight so that exercise doesn't hurt your joints anymore. You use it to reset your relationship with food, to break free from processed junk. It's a support system to help you build a brand new, sustainable, healthy life that you can actually live in long after you stop the injections. And so, all of this leaves us with one last big question, and it really cuts to the heart of the trade-off we're all facing now. Let me ask you this. If you could take a pill that made you thin, that gave you the body you've always dreamed of, but the price was that you could never again truly enjoy your favorite meal, would you take it? Is that a price you'd be willing to pay?